Good afternoon, everyone, and welcome to our Peptide Zoom webinar with our expert Rachel Gunderson, nurse practitioner and Utah Clinical Lead Director of Joy Wellness Partners, Utah. Rachel is a huge fan of peptides, as I am as well, and we hope that we'll give you guys some knowledge and some tips and tricks for how you can implement peptide therapy in your lives and bring so much benefit in a preventative way for longevity and feeling great in the moment as well. Rachel, I'll let you take it over from here.
Perfect. Thanks, Carol. So yeah, I just a little bit more about me. As Carol said, my name is Rachel Gunderson. I'm a nurse practitioner. I am dual certified as both an acute care adult nurse practitioner and a family nurse practitioner. And so, which means I can see patients from birth to grave, essentially. I am the clinical director and a provider in the Utah Joy Wellness Partners. And I love peptides because of the way they fit in so well with regenerative medicine and allowing the body, they support your body's ability to heal itself and regenerate tissue and help you reach the goals that you have for yourself. And so let's get started. So, what are peptides? They are such a hot button topic right now. If you are on TikTok or if you're on Facebook or any type of social media, people are starting to really talk about peptides. And so that's the big question. It's like, well, what are they, right? Because we hear them and we hear this word and it's like, oh yeah, I take this collagen peptide. Is that the same thing? Like all these kinds of stuff. So let's just go simple. We're going to start with that. What are peptides? So peptides are short chains of amino acids, which are the building blocks of proteins. They typically consist of 2 to 50 amino acids linked together by peptide bonds. Unlike larger proteins, though, peptides are small enough to be absorbed easily by the body and can serve as signaling molecules, communicating specific instructions to cells and tissues to initiate certain biological functions. So peptides occur naturally in the body, and they play a crucial role in many biological functions. They are involved in processes such as hormone production, immune responses, and tissue repair. The body is constantly producing and using different peptides to regulate a variety of functions. This is when I tell my patients who are in my office, I'm like, there is one peptide that you know, but you don't realize is a peptide, and that's insulin. Insulin is a peptide that helps signal to our cells to open up. So our glucose, which is hanging out in the outside in our blood, outside our cells, it opens that door so that glucose can get inside and get into our cells and to the mitochondria and do all of those other amazing things. And so there are lots of peptides that are out there. But as was mentioned, they are similar to proteins, but they are different. They have the same building blocks, but they're smaller. So I always like just differentiating between peptides and proteins. So like I said, peptides are smaller. Generally, they contain 50 or around 50 or fewer amino acids. They are a simple structure. Their primary role is to act as messengers and signaling molecules, where proteins are large and more complex chains of amino acids. So you're looking at more than 50. A lot of times when you get a protein, it's folded into an intricate, like three-dimensional shape. And so, which means, yeah, it has dimension more than just a peptide. Usually these are enzymes. They have a structural component and our proteins are able to carry out much more complex metabolic processes. So they have bigger roles than just our peptides do. So peptides play a key role, like I said, so what's their big role in the body? Their big role is to be a signaling molecule, to get your body to start something. They trigger a range of activities in the body, such as stimulating the production of growth hormone, modulating our immune responses, and promoting tissue healing. We're going to talk about these as we go on, but like I said, we're going to start in general peptides, right? These regulatory functions are critical for maintaining overall health and homeostasis. So how do peptides actually work? So I'm telling you, right? They're going to hit these cells, they signal, they are messengers. Sorry, I'm just going to pull my things along so I can see where I'm at. But there's different steps, right? And I always want my patients to have somewhat of an understanding of why we're doing things so that they can see how it's going to impact their life. So we're going to talk about the mechanism of action. So these are the four main steps of peptides in a broad general sense, right? We're going to talk about some more specific ones in a minute, but okay, so they have a binding, the peptide's going to bind to the receptor. It's going to do signal transduction, activation of cellular responses, and downregulation. Like, so what happens after it's started its thing? So let's start with the peptide. What happens is that peptide comes along and it sees a receptor. This is like a lock and key, right? Every peptide is specific to a very specific receptor. Like I said, the lock and key is the perfect analogy. So peptides function by binding to receptors located on the cell membrane. These receptors are highly specific. And once the peptide bonds to that receptor, it unlocks it and it activates that receptor. And so it causes something. This is how our peptides talk to the inside of the cells to make them do things. So once that receptor has a peptide bound to it, the receptor undergoes a change and it activates the intracellular, so inside the cell, a pathway. And these signaling pathways are often complex networks involving various molecules and enzymes and other messengers that take it deeper into the cell, either into the mitochondria or into the nucleus where there's DNA, triggering different responses, which is the next part. So the activation of the cellular response, what are we trying to get that peptide to, like, what was the message that the peptide was telling it to do? So the signal from the peptide, right? We hit the receptor changes and sends a signal inside because the peptide doesn't get in. It's that receptor that changes and signals this response. But so then it's going to activate a chain of events on the inside of the cell that's going to impact you and your cells. And it can vary. It can be, like I said, into the nucleus for gene expression. It can be protein synthesis, cell division, metabolism, or immune response. It just kind of depends. Like if you're doing a peptide that does growth, you're going to get a growth hormone releasing peptide. It's going to stimulate the production of that to help you to stimulate that. Just real quick, if someone has their microphone on, if you don't mind muting it, just so that we don't get any feedback. Thanks. So the next step, so right, we've gotten it to do what it wants. We have it to where it's done that thing, right? We're going to pretend that we're looking for gene expression. So it's hit the nucleus. We've got it to do its thing. What do we do with it? What happens next? So we're going to do downregulation and recycling. So after the peptides have fulfilled their role, they are degraded by enzymes known as peptidases or proteases. The aces on the end let you know that it breaks it down. This ensures we don't want them just lingering around because they're constantly stimulating that receptor, and that receptor can get tired, worn out, or you just worry about unintended effects. And so the receptor can also be recycled or downgraded depending on what the process is we were looking at. All right. The cool thing about peptides is they are very targeted. They're targeted to a system. So it helps us to make sure that we're having the type of response that we really need. So here are our main body systems that we have. So for the endocrine system, what it does is these processes, once again, this is what we're talking about, what we want to have regular, or the response that we're trying to initiate inside a cell, but it can help enhance muscle recovery by giving more growth hormone release, increasing the muscle mass. It can support anti-aging therapies by doing that, as far as looking at the different hormones that can come. In our immune system, peptides are great with regulating cytokine production, enhancing natural killer cells, activating dendritic cells, stimulating T cells, and minimizing viral and bacterial activity. Those are the responses that we're looking at, once again, that we're trying to get these cells to produce. For our nervous system, peptides, the response that they're going to do is they're going to increase neuroplasticity That is referring to how our body learns things and how we create, how our brain learns things and how we create memories. When you have good neuroplasticity, you have a really healthy brain and you're able to continue to learn and create memories. It's going to protect neurons from damage because it's going to help create a process or initiate a process inside those cells to protect themselves. But it's also going to release or promote the release of neurotransmitters that improve focus, learning, and mood, because those all come from inside cells. They have to be released into our blood supply so that they can hit other cells. For our cardiovascular system, some of the processes that happen is they help with blood pressure regulation. They're going to improve heart muscle function. They're going to prevent oxidative stress because these are all things that our cells can do if we help support them with the products that they need. They're also going to help promote healthy lipid levels, and lipids are your cholesterol. Musculoskeletal, like I mentioned above, you're going to have muscle regeneration. It's going to help improve your bone density. That's one of the processes that they can hit those cells and help them produce more dense bone. And it's going to help with reconstruction of tendon and ligaments. For our digestive system, we do find that we have peptides that go into those cells in our digestive system and help heal ulcers, reduce inflammation, and then they cause processes that can help heal leaky gut. And so people are like, hey, these sound great. Like I can see why people are into these. They have a lot of good options. And so, but which is better? Like I like these things, but how do these compare to other options on the market if I'm trying to gain these things? And so let's do a comparison of looking at how peptides work compared to pharmaceuticals. So just being general like medications. So peptide therapy are natural compounds. They are generally made in a lab or produced from other products, but they're things that naturally occur in our body, which means they are generally well tolerated. So you have a lower risk of side effects compared to pharmaceuticals, which a lot of times aren't things that naturally occur in our body. As I mentioned before, they have a targeted action. Peptides are used to make a very specific mechanism happen on a tissue or a cell or a pathway, which then gives us a very specific response, which helps reduce the risk of unintended effects. I'm going to talk about this when we talk a little bit more about pharmaceuticals over on the slide. But because they do have fewer side effects, because they mimic the body's natural processes, peptides usually don't have any of those crazy side effects that if you've listened to any type of commercial for a drug, it's like, may cause blah, 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 blah. And you're like, whoa, that sounds worse than the problem. But with peptides, because they are naturally, they mimic what our body does, they usually don't come with big organ issues, systemic reactions, stuff like that. There are some good things, though, about pharmaceuticals. They do have a broad action. Like I said, targeted, very much like the rifle approach, where pharmaceuticals more of that like shotgun broad approach. So drugs like statins and beta blockers may affect multiple systems in the body for good or bad, which can lead to higher risk of side effects and organ damage. One of these that I think about a lot are beta blockers. We use them a lot for blood pressure, but if you're not careful, they can affect your respiratory and your pulmonary system, right? And so you have to just make sure that when you do a medication, that it's able to really get what you're looking at. Symptomatic relief. A lot of pharmaceuticals are meant to treat symptoms and not root cause. And as a functional medicine clinic, we really want to look at that underlying cause, because part of the joke that we use is that the example of insomnia, you're not having trouble sleeping at night because you are deficient in Ambien, right? So giving you an Ambien prescription is not going to fix it. You're not sleeping at night for other reasons. And so finding that cause is what really can help make a good can really help cause or fix that underlying cause. And that's kind of what peptides do, right? They're helping to hopefully balance your own natural body so it can fix itself. So peptides versus biologics. So biologics are a class of medication that, sorry, I just lost my place. Um, uh, yeah, they're a class of medication that usually comes from a living organism or another highly evolved process. So, peptide therapy, once again, as we mentioned, it is a smaller molecule, which makes it more simple than biologics, which in this case just means it's easier to produce. Like it kind of is on here a couple of ways, but it's all the same kind of message. It's just easier to use and it's easier for your body to use, which also helps them be more cost effective than peptides, more cost effective than biologics because biologics are amazing and they are very complex, but then it causes a more or it requires a more complex manufacturing process, and so it just makes that more expensive. Also, peptides, because they are naturally occurring, once again, similar to our body's own substances, it's less likely you'll have any type of immune reaction or like an allergic reaction or immune suppression, which sometimes is what can happen with biologics, but I do say that is sometimes what we're looking for with biologics as well. So biologics are very powerful immune modulators. They are designed to target specific aspects of the immune system or cellular function. And they are highly effective for treating diseases like rheumatoid arthritis and cancer. But with their increased complexity, there are more risks that can come with that. And there is a higher cost. This is one of those, and once again, this isn't trying to be like, oh, always do peptides over pharmaceuticals, always do peptides over biologics. That's not the case. I'm just comparing them, right? If you have a biologic that can get done what you need better than the peptide, then use that biologic. Or same with a pharmaceutical, right? That's not what we're trying to sell here. Nutritional supplements, right? Like because can you get the same results with nutritional supplements? So the thing with peptides, once again, direct action. It's going to do that very targeted, specific action on your tissues, your receptors, and you'll get quicker results. And a lot of peptides do have scientific basis where they've had clinical research that shows those clear mechanisms of action, where supplements are more generalized and indirect effects. Some supplement companies do a wonderful job at providing us with scientific research and clinical research that lets us know that we can expect those benefits, but sometimes supplements are not there with that type of clinical basis. But nutritional supplements in general, they're more for general health benefits. Please be on supplements. They help with overall wellness. They are going to help with essential nutrients and give you those building blocks that you need to perform all these things. But you're going to have a hard time getting more specific targeted action with like supplements over peptides. And also they just generally tend to be slower acting and less potent. And so hopefully at this point, you're like, okay, this sounds great. They're natural. Our body, makes them. It seems like this would be a good option for like what we are. So what are the options? What can we do? It always kind of, I just kind of laugh or giggle to myself when people come to me and they say, I want to do peptides. And it's like, okay, because there are around 3,000 naturally occurring peptides in our body, and they do a whole range of things. At Joy Wellness Partners, there's about 20 different peptides that we regularly prescribe and utilize in practice. But they do a lot of things. And you saw that, right? It can hit the endocrine system. It can hit your musculoskeletal. It can hit your immune system. It can hit your heart. It can hit your nervous system. It hits your gut. And so one of those things is like, hey, what are your goals? Right. And so that's what I always say to my patients when they come, like, what are your goals? How can I help you? And how can we use peptides to reach those goals? And so I've just chosen like 4 of my favorite peptides to highlight. If you do have other questions, please feel free to let us know. We can go over those. But we're going to start with BPC or body protective compound 157. If I had to choose one favorite peptide, it would be this one. This is my workhorse that I just love. All of the cool things that it does. So its specific mechanism of action is it helps promote tissue repair by doing angiogenesis, which is formation of new blood vessels. It's also going to enhance the proaction of growth factors such as VEGF, which is a really good growth stimulator and tissue repair, and stimulates the migration and proliferation of fibroblasts, right? So when it gets into cells inside the cell, right, it hits the receptor responds, it initiates a signal inside. These are the things specific to tissue repair that it makes these cells do. For anti-inflammatory effects, it inhibits inflammatory cytokines and modulates the immune response. There are good cytokines and bad cytokines. And so what this does is it helps bring down those bad cytokines. A lot of people we're learning a lot more about all of the bad effects of inflammation. You do need some. You can't just wipe out 100% of inflammation. If you have that question, let's chat sometime. But I do believe that a lot of what we deal with in our bodies with health has to do with inflammation. And that's one of the reasons why I love BPC 157 so much, because it's so potent and anti-inflammatory. It's just going to turn it down. It's not going to mask it. It's just going to help your cells not produce as much. Like I meant, it's a big gut health healing one. It helps actually strengthen the intestinal barrier and repairs your gut lining once again. And those cells tells it, hey, let's protect against these harmful toxins and pathogens. Let's make a better lining so that you can heal stomach ulcers. You can do leaky gut, all those kinds of things. It's one of my favorites when we're doing gut health with peptides. And then it does have modulation with the nitric oxide pathway. So your nitric oxide pathway has to do with vasodilation and blood flow and balancing oxidative stress. And so it has it does that, balances between your nitric oxide reactive oxygen species and overall prevents that excess inflammation through that pathway. And so it's got some really cool things. So body protective compound, I think of it for applications for like so many things. Tendonitis, ligament injuries, overuse injuries, any type of joint sprains, strains, pains. I'm looking at BPC 157, bursitis, gastric ulcers, irritable bowel syndrome, inflammatory bowel disorder, Crohn's disease, leaky gut, ulcerative colitis. Looks like I got gastric ulcers on there twice. Really wanted to get that one on there. It also is really good for traumatic brain injuries, concussions, stroke, surgical wounds, generalized inflammation, burns, and skin conditions. There's research about using BPC for even like acne to help turn that down. So it's a great one. And that I just love how powerful and effective it can be. It's one that I will put people on for such injury. They're like, oh, I have this hip injury. And we get them on that. And all of a sudden they're like, hey, my gut's better. Or my shoulder, which has always just kind of bothered me, I don't think about it anymore, feels better. Yeah, I think it just does a really great job. So the next one is Cerebral Lysin. This is when people start talking about issues with the nervous system or the brain, with like stuff like that. I think of Cerebral Lysin. And so a lot of what it focuses on is like the nervous system. So it's got neurotrophic activity. So it mimics neurotrophic factors such as the nerve growth factor and brain-derived neurotrophic factor, which promotes neuron growth, differentiation, and repair, right? That's huge. It's going to help you make new neurons, new nerve cells, which there's not a lot of medications. I can't think of one that can do that. It's neuroprotection, right? It's going to reduce free radical formation to limit your oxidative damage. And so it's going to also inhibit the overall activation of excitatory neurotransmitters like glutamate, right? And it's going to reduce inflammation right in your brain. It's a huge one in the central nervous system. And so that's why I love it, because it's going to hit those cells and really make sure that they are getting that inflammation cycled down, right? Because once again, it's not masking it. it's going to actually downregulate it because it's going to reduce the production of pro-inflammatory cytokines so that you don't have it. It's going to improve synaptic plasticity, which is like we talked about that neuroplasticity because it helps those cells, your neurons. It kind of helps them just to be able to learn and to grow and to create memories. And so anybody who's got some cognitive impairment, I think of this one. I like to throw this one on. And then energy metabolism and mitochondrial function in these brain cells. It's going to hit the mitochondria so that it increases your glucose uptake and ATP production in your neurons, helping those neurons to survive and repair themselves after injuries. It's so cool. And so applications for cerebral lysin is like Alzheimer's disease, dementia, stroke, concussion, traumatic brain injury, Parkinson's, cognitive impairment, and neurodevelopment disorders. I did just see a study. They are coming out with using cerebral lysin in kids for these like neurodivergent type of things like autism. And I've not seen it. I just saw like a tagline that there's, some studies starting to be done about that, which I thought was very exciting. So next, a unique peptide that I love is Thymosin Alpha-1. We do have another one called TB4, Thymosin Alpha or Thymosin Beta 4. It has that same, it comes from the thymus gland, which as adults, we don't have anymore. And so we lose this ability to have this peptide naturally as we age. But when I think of Thymosin Alpha-1, I always think immune system and the great benefits that it can do. And it hits the immune system in these following ways, right? So it's going to help promote the maturation and activation of T cells, that's cytotoxic and helper cells, and also dendritic cells and natural killer cells. So these are the cells in our body that do different things. The dendritic cells are going to go out and find the antigens on foreign invaders, right? They're going to go out there and they're going to find them. And they're going to bring them to these toll receptors, which is the second part, that they actually recognize the foreign invaders, like viruses, bacteria, and cancer cells. By enhancing that, you're going to make your immune system more efficient and able to fight these types of things. Once again, we've got a good reduction in inflammation by down-regulating bad pro-inflammatory cytokines and upregulating the anti-inflammatory cytokines. So our pro-inflammatory cytokines are IL-1, IL-6, TNF-alpha, and then it increases the anti-inflammatory cytokines like IL-10. So apoptosis, promotion of apoptosis, most people have never heard of this, but this is a programmed cell death. This is when the body, because our cells don't have an infinite lifespan. They cannot live forever. They need to go, they need to be destroyed. They need to be filtered out, or we end up with zombie cells. And I love that concept of zombie cells. But so what it does is Thymosin alpha helps promote apoptosis to help clean out and get those cells that are infected or cancerous to clear the body so that they're not causing more issues and they're not causing problems. You do also get immune system restoration by individuals who have compromised immune systems or weakened immune systems secondary to medications they've been on or different autoimmune conditions that they might have because of these functions that are listed up on the slide. By activating those things and helping them be more potent and more receptive, you get better, you can restore their immune system. So I always think of Thymosin alpha for viral infections, cancer immunotherapy, autoimmune disorders, immune deficiency disorders, chronic inflammatory conditions, or people who are dealing with sepsis or frequent or recurrent infections for sure. All right. So the last one that I want to highlight is the peptides that we prescribe. is CJC 1295. This is considered a secretagogue because what it does is it mimics the the action of growth hormone releasing hormone receptors. It's quite the mouthful. But what it does is it goes in, it hits those receptors that are in the pituitary, and then it prompts your body, those cells, to then release the growth hormone. And so as we age, our levels, our growth hormone decreases because our body, for some reason, is programmed to think it doesn't need it. But when we're young and we're feeling great and we're able to regenerate and recover really well, we see that those growth hormones are higher. And so we like to just naturally bring it up. I do have a lot of, we'll talk about that later. It's going to increase your insulin-like growth factor, which is another really great level. What it does is it hits those receptors. I'm sorry, it looks like I forgot to fill in the rest of that bullet. But what it does is it once again hits the receptor on the outside of the cell that then prompts the cell to release and increase the production of insulin-like growth factor, which is again similar to human or to the growth factor hormone, and will help. The nice thing about CJC compared to other medications is that it has actually a longer half-life. It's able to bond to albumin in the blood to make it work better and longer. So you get it. The one big thing why I love secretagogues over HGH, human growth hormone, because I do have patients who come to me and say they want to get on that, is that it actually promotes pulsatile growth hormone secretion. Because it's going to work in your body's natural ability, because that's what happens in our bodies. We are not constantly making growth hormone at a steady state. Our levels go up and then they go down and they go up and they go down. They're actually the highest at night when we're sleeping as we get into that parasympathetic state, both in our cells and everything. And so when you give yourself exogenous growth hormone, you are flooding your system and you take away that pulsatile effect. And so your cells just get super overstimulated and you start to worry about risks of big side effects. But what CJC and these other secretagogues will do is they work with the body. They help mimic that pattern of high and low without overwhelming it, which helps reduce the risks. And so that's why that's my choice to go that way. So applications, anti-aging therapy, muscle growth, athletic performance, people who are trying to really get gains or want to stay working out a lot, looking for fat loss, improved sleep and recovery, bone density, tissue repair and healing, and cognitive function. There are some benefits there. All right, so those are the 4 that I decided to highlight, but there are some risk factors and safety considerations that I try to share with all peptides that can happen to varying degrees. So some side effects that we educate our patients on when they start peptides are a majority of these peptides are given via injection. And so you might get an injection site reaction just from where you inject that. You might get some headaches depending on afterwards with doing injections. You might get some dizziness, nausea. You also might get some fatigue, which seems counterproductive. Most of the research on this comes from the fact it's just at the start when your body's trying to kick in and start using up those peptides. Also, you might get a little bit of water retention, and then joint pain or stiffness kind of goes along with that. You get a shift in fluids as your body is trying to heal and trying to bring more growth factors and stuff to the areas. You can get some fluid retention. And then increase in hunger. This one can be very frustrating for people, but that can come when you're having a higher metabolism, so your body's wanting more fuel to help fill that. You will notice I forgot to mention I didn't highlight any of the weight loss peptides like semaglutide, tirzepatide, retatrutide. I feel like that's like a whole nother side. I fully 100% acknowledge that they are peptides. They are super popular. I just chose not to highlight those for this presentation. And so, but it is something that we talk about. As far as risks that can come with peptides, you do have to be careful that you don't get a hormone imbalance. This can come from more of our growth hormones, because if you are pushing your body to produce and to grow, part of that can happen is that you can produce more hormones. This can also be a risk if you are already on hormone optimization and you're not getting watched. You can also get insulin resistance, because by promoting growth, sometimes you can also be promoting the production of more glucose, which can then make your insulin require more insulin. And then when your cells have to require more insulin, you start to worry about insulin resistance, which then can lead to diabetes. You do have to worry or keep in mind about kidney or liver strain, right? These medications do have to be metabolized. Like I said, they get down-regulated. They're not just happy and living in our bodies forever. Where are they going? Are they going out through our kidneys, or are they going out of our liver? Immune reactions, right? Are we having some type of allergic reaction? Or what can also happen, I see this more, or I've read about this more, when people get peptides that are low quality, because a lot of low quality peptides, they are not filtering out something called LPS, which is lipopolysaccharides, which can lead to immune reactions. Not as much like anaphylaxis or these injection site reactions. We're talking more about they cause our body to react and not like the peptides. So you could be using them and they become less effective because of those LPS in them. And those are our higher quality peptides. They filter those out. And so that's one of those things you got to know about, right? Tumor growth, this just happens once again. If you have a tumor or something unknown and we give you a bunch of growth stimulating peptides, they can grow, right? And so you need to have that monitored. You can also have overgrowth of tissue, which kind of leads into this heart issue. Those kind of go together. It's called acromegaly, where your organs get bigger. And then there can be interactions with medications. And so that you're on, that your prescribers put you on, like, and I think that kind of goes back to that hormone imbalance. Like, are you giving yourself testosterone, but then you're taking a growth hormone and you're really shooting up that testosterone level unintentionally and causing effects with that. So people look at this and they're like, okay, well, there's all these risks, all these side effects. Like, why should I be doing these? It's like, the thing is, it's you just have to be aware of them. And I feel like this also underlines why it's important to have a good, competent provider help you on this journey of using peptides, because otherwise you can go out and you're right, you can find peptides on Amazon, you can find them everywhere. And you can just start injecting and seeing, and it's like, oh gosh, well, like, who's watching to make sure your levels, to make sure your kidney and liver aren't strained? Who's watching to make sure that your hormones are staying in balance and making sure that you're not having problems with resistance, insulin resistance? Like, who's talking to you about the nausea that you're having? Like, who's making sure that you're hitting these goals? That's where having a really good, competent provider with who knows peptides, who knows about these side effects and these risks and how to mitigate them to ensure that you get your goals and we minimize these risks. So hopefully this, you're like, hey, yeah, I understand peptides, chains of amino acids. They're little, they're simple, they're targeting. I can use them if I have a goal that I want to get. I want to heal this injury. I want to boost my immune system. I want to just have better longevity, right? I can use them and they're very targeted. So hopefully the question is like, how do I start? And the best, easiest thing is get a consult with us. You can come see me in Utah. I'm in Provo, or you can reach out to our San Diego clinic and see the wonderful providers down in San Diego, and they can get you started. We just, like I said, we sit down and we say, hey, what are your goals? Like, how can we help you reach these? Which peptides are you interested in? We talk about risk factors and all those things so that we make sure that you're successful and that you reach these goals and you stay safe and that you have a great experience with peptides. So you can book online. Go ahead, you click on, it's joywellnesspartners.com. In the upper right corner, you will see a book now button. Then you can choose between the San Diego or Utah clinic. And from there, then you can go ahead and book online for a peptide therapy consultation. Or feel free to call and text us at either of our numbers. They're great. One last thing, I do want to highlight that in the month of November, we are running a deal on our peptides where you buy one vial of peptides at regular price and you get the second vial of peptides at 50% off. I do want to put out that does not cover or that does not include our weight loss peptides such as tirzepatide, semaglutide, or retatrutide. Well, with that, thanks to those who joined in and listened to my talk about peptides. I do love them. I've seen them do amazing things, both in my personal life, with my family, and with my patients, just seeing the impact that it does. And I love seeing what our bodies can do when we give our bodies what they need and what they are true, like looking at that cost and doing. So, but thanks to everybody for joining in, and please feel free to reach out to us if you have questions or with call or text, or you're welcome to reach us at info@joywellnesspartners.com or utah@joywellnesspartners.com. Thanks.
Thanks for watching. I'm Carol Joy Bender, the founder and nurse practitioner at Joy Wellness Partners. If you found this video helpful, give us a thumbs up. Please subscribe also to our channel and share this video with someone who you think could benefit from it. You can also learn more information about these services by clicking our link in the description below. You can also leave a comment to let us know what content you'd like us to put out next week. Thank you so much for being a part of our community, and stay along with us for enhancing wellness in our world. See you next week.